One of the stats that just blew my mind was from the National Council on Aging. They said 80% of older adults live with at least one chronic disease and 68% have at least two or more. Many adults with chronic conditions struggle to manage them. Talk to us a little bit about this epidemic around chronic disease and the importance of helping patients.
When I was working in hospitals and rehabilitation centers, I noticed that patients were there for things that could have been prevented. Those are chronic diseases. Health literacy, health education, access to resources, looking at what those barriers are, those social determinants of health. As a health educator working for government agencies and medical centers, I've been able to help develop different programs.
Hey everyone, welcome once again to Medical Practice Success Secrets. This is Theo Harvey. Super excited about another podcast and another innovator in healthcare that we're speaking to. Today, I have the honor of speaking to Brittaney Jenkins. Brittany is a dedicated public health practitioner, speaker, and executive mentor with over 12 years experience in healthcare and public health. As a founder and CEO of Jenkins Public Health Consulting, or JPHC, this is a woman-owned, minority-owned firm based in Alabama. Brittany has built a reputation for excellence and impact. She has been recognized for her contributions to public health and is awarded Rising Star by the Alabama State Public Chamber of Commerce. She's been featured by Marcus Who's Who for excellence in public health and served in key leadership roles, including chair of the Smoke-Free Indy Coalition and vice chair of the Toxicology Board and Vanderbilt Medical Center. Her commitment to improving community health outcomes and supporting the public health workforce makes her a sought-after consultant, speaker, and mentor. Thank you, Brittany, for joining us today. How are you?
Thank you so much. I'm doing well. Thank you.
Great. So one of the things that we wanted to kind of get into right away was just the need. Your expertise is around chronic disease management and specifically education. And one of the stats that just blew my mind, I think it was from the National Council on Aging. They said 80% of older adults live with at least one chronic disease and 68% have at least two or more. Many adults with chronic conditions struggle to manage them. So talk to us a little bit about this epidemic around chronic disease and the importance of helping patients.
Yes, for sure. Such a good point. My career in healthcare is what really led me to prevention, to public health. And when I was working in hospitals and rehabilitation centers, I noticed that patients were there for things that could have been prevented. And those are chronic diseases, right? And so for me to see these patients struggling and at a time in their lives where some of these patients were dealing with amputations, memory loss, so many different challenges, not being able to be with their families, losing their jobs. And so I changed my career to public health so that I can increase health literacy rates among adults and youth. And I think that definitely pours down to our children in our community when we are more informed about our health and make informed decisions about our health. Health literacy, health education, access to resources, looking at what those barriers are, right? Those social determinants of health. And as a health educator working for government agencies and medical centers, I've been able to help develop different programs that have improved health outcomes, improved health literacy, improved trust and rapport among health professionals and community, and so much more. But the chronic disease background that I've obtained, it just really hit home that these things are preventable, and creating programs and relationships within the organization and community is essential to overcoming some of those barriers.
No, that's very insightful. I think what we're seeing is obviously the importance of prevention and helping patients and chronic conditions. Unfortunately, they never go away, but you can manage them better and more effectively. So my company, we do a lot with diabetes management. We utilize continuous glucose monitors to help patients manage diabetes more effectively. And so we're seeing impact that way. But education is key, right? Understanding the importance of how to navigate diet and exercise to kind of manage that more effectively.
Absolutely. But when people hear like diet, exercise, healthy eating, they think of things that are boring, and it can just be some quick substitutes. Even they say getting out for 10 minutes a day, 30 minutes a day is all you really need. You don't have to be this gym rat in the gym for hours on end to live a healthier lifestyle. There's small changes you can make with your food, your environment, your habits. I love talking about tobacco cessation because that's also a risk factor for chronic disease onset. And changing up your routine is a huge thing as well. So what we do with what we know is also one of those things about taking action and accountability for our health.
That's a good point. My parents were smokers for a long time. And so to your point, there were certain triggers, right? Maybe after a meal, they would go smoke, or maybe they saw it as a social gathering. And so maneuvering and changing that behavior trigger, kind of say, okay, maybe I chew gum after I have a good meal instead of, smoking. And so that helped them alleviate some of the smoking habits that they started down the path of many, many years ago. You're right. Just those simple choices and just being consistent can help in changing behavior for the long term. I get that part. When you kind of look at the overall understanding of like how healthcare organizations are looking to educate patients, right? Obviously, they have staff members, social workers, nurse practitioners, medical assistants, obviously doctors to kind of help navigate that piece. But why is it important to partner with, like, say, for instance, a certified health education specialist or CHES, getting that certified professional embedded inside healthcare organizations? Is that an important factor to help navigate that? What are they bringing to the table that maybe non-certified clinicians bring to the table?
Yes, absolutely. So I'm a certified health education specialist. I am always excited to talk about that topic. And I think more public health and healthcare professionals should look into that certification, which is different from a certificate. A person who is CHES certified is nationally certified and recognized to do the work that they're doing. And they have to prove that they have the experience to also carry that certification. But we play an essential role in encouraging healthy lifestyles to prevent chronic disease, to prevent injuries as well. There's a lot of people who are CHES certified who have a lot of different backgrounds in public health, but to me, I have a chronic disease and injury prevention background. And partnering with the healthcare system and primary care clinics is essential, again, to encourage healthy lifestyles and identify those barriers, right? There are health organizations that are doing assessments, but what's happening after those assessments, right? Are we really making sure they get access to the care that they need? Because we don't really see that happening a lot. What are those different barriers, right? I talk about the health belief model that more health education specialists or health professionals who are doing any type of education with their patient should work through to understand the barriers. Do they believe they're susceptible? The whole step of the health belief model that I don't know by heart, but it's really effective in meeting the needs of that patient and really getting down to the root cause of what's causing them not to take action. Because sometimes it's not just lack of literacy. Sometimes it is the social norms, cultural norms, what they don't believe could happen to them, right? Some people think they'll never get a chronic disease, and it can happen to anybody, right? Even if you are trying to eat healthy, there's other factors. There's environmental factors, right? You don't have to be a smoker to get chronic disease. You can be exposed to first, second, or third-hand smoke. People don't usually hear about third-hand smoke, but that is also a risk factor, smoking or even being around that type of environment. So really digging deep and connecting with certified health education specialists, which we can get a lot of different write-offs for health organizations when we're partnering with them, right? For doing different types of screening, health education, all those different billable services. When we partner with them, there's still reimbursement there. And all those individuals who are in the emergency department room, who are sitting there waiting to be seen, sometimes those are prevented, right? Sometimes they really don't need to see the physician in the ED. They just need to be educated and, checking some basic things and sending them along their way with the actual care plan that is manageable.
Yeah, more you're talking about this, I'm seeing the need for individuals to come into any organization, to kind of manage this process, because there's been a big push to value-based care versus fee-for-service. And a lot of more healthcare organizations, and value-based care is basically just a fancy word for saying the continuum of care. And the way you kind of lower costs, right? Triple aim is access, cost, and quality. The way you kind of lower costs is doing things that are more preventative in nature, because they tend to be lower cost in delivering those type of services. So we're seeing a lot of movement toward value-based care programs. I think there was some study that said that by 2030, they want the majority of all programs, like under Medicare Advantage programs, to be under value-based care programs, because they see the numbers, right? And so having a CHES certified individual coming to your organization, helping through that process, and you're right, they're putting a lot of reimbursement to that. One of the things that we saw this year is the Social Determinants of Health survey. Every year, every primary care, or even some internal medicine or individual practices can do these annual wellness visits. In addition to that, they do a SDOH, or Social Determinant of Health survey, every 6 months to determine patients' food insecurity, travel needs, just all the outside things that they may need to kind of help with their healthcare. And so you're right, that is something that's reimbursable.
Yeah.
Do CHES educators, do you guys help with those type of things as well, kind of managing that process with the patient populations that you work with?
Yes, and we do as well. But sometimes there's a point where social workers will need to step in to support that patient even more, because we're not social workers, and there's like that start and stop line between certified health education specialists and social work, and even community health workers, CHWs. But we can make sure that they have the resources that they need. What grinds my gears is when we identify the resource need that this person has, and we're like, hey, here you go. Call the food bank. Here you go. Here's the number to the bus transportation line. That's really not helpful, because you don't really know, okay, can they get there? Can they call? there's so many other barriers than to just give a piece of material to say, this is the resource you need, here you go. So really making sure that they get access, right? And the point about integrating certified health education specialists is the physicians, the healthcare professionals can identify that need and then go on to serve more patients. And then that's when the certified health education specialists step in to continue that care, right? And then if social work related things are needed or come up, then we partner with them. And this physician is also able to keep track of what's going on with their patient. Those SDOH assessments will still be in place. But I think the wraparound care is what's really missing, because we're just looking at like one thing and it's a subcategory of things.
You hit the nail on the head. I think that's the challenge in healthcare now. To deliver all these services, you need a team-based care option, right? So you have your certified health educators, you have your pharmacists who can help with medication compliance, you have your social workers, right? And you even have your caregivers, right? And how they can impact care. And that has to be a part of a whole package, right? And then how you coordinate that seems like it's been a challenge somewhat, right? Healthcare.
Yeah.
That's a challenge in anything, any kind of complicated system is always challenged to manage that many moving parts. But if they can all flow and work together, which is the promise of value-based care, then we can, ultimately help the patient more, right?
Absolutely. And I feel like when I'm talking about this to other health professionals, like they deserve to have time for themselves and their families when they're trying to do all of the things for these patients, which has been part of the process, part of the system. They are overworked. They're managing so many different patients with all these different needs that they're trying to make sure that they are being good to their patient and serving their patient fully. But that doesn't all have to be on them, because that's why these other nationally certified professionals are here for you, right? And it's just integrating us into a system that, is a little controversial from a health professional side, a health educator side, but we're supposed to work together for the best outcome of that individual, that patient. Hospitals can still run fully, right? Put us in a spot within the hospital that we can still have patients coming into the ED, coming to see their doctors, but still getting the full care that they need. And have the trust, right? Because it does affect patient health outcomes. Ignoring pain, we know the science and research about that. It just goes much deeper than, they've identified a need, but how are you treating your patient? How are you communicating with your patient? Are you delaying access to care that they have stated that they need, but they don't look like they need it? I've been a victim of that myself, so I know it's happening. But as a professional who understands the system, I've been able to navigate that. But I can't say no one, but a lot of people are in that same position who are dealing with that.
We talk about that all the time. Culturally relevant or multilingual support, or just having a professional, healthcare professional that understands your needs, right? That looks and sounds like you, came from the same background. I went to several conferences in the payer community, right? And they were talking about trust. Like, how do you build trust with patients instantly via the phone? Because a lot of times patients, and especially in certain communities, Black and brown communities, the trust is very low. And so they don't respond. They'll communicate, and you can have all these omni-channel, reaching out via email, reaching out via text, sending mailers. But if the patient doesn't trust the system as a whole, it's very hard to penetrate. And you hit the nail on the head of creating relevant kind of communication channels so that patients are responsive, right, to their care and are engaged in their own care. Because ultimately, they are dictating how they're going to receive that care, and how you penetrate that is so key.
How do you motivate behavior change or improvement or maintenance as the professional who are overseeing this individual, this patient? I wanted to address that looking and the cultural relevance and how we look, talk, or act towards our patients. That is very, very important. But I've also seen when DEI really hit the fan, how all these health professionals who were not minorities, right? Caucasian, white professionals who wanted to be fully understanding of DEI practices to better serve their patient. I saw a lot of mistakes come from that. Interestingly enough, there were some white women in leadership positions, CEOs of organizations, who actually stepped down and gave their title to another Black individual because they felt like their background was more fitting for serving that community. Though I advocate for the cultural relevance and all the things, that was actually a mistake, because the CEO knew that community for decades. But this new Black hire didn't know anything about the community, and everything crumbled. And so it's like how you interact with your patient. I'm gonna speak for myself. I don't have to have a Black doctor to know that they care for me, but that's not everybody, right? But at the same time, you have to be intentional with your interactions with your patient and identify any biases that exist, right? There's over 170 different biases. We all have them. If you don't say you have them, then you're not being honest, because we all have them. But identifying what those are personally and addressing those, or being mindful of anything that has triggered you to think about somebody different or treat someone differently or say something about someone that wasn't fair to them without you really knowing them.
If you have a history background, you understand this community, and you've been doing the work for decades, then you are the best person to handle that. Doesn't have to go by your ethnic background,
Right.
your cultural background. So I agree. I think sometimes people say, oh, you can't get this job or you can't do this because you don't look like the patients you serve and things of that nature. But
Yeah.
I agree. It doesn't have to be like that. And I know it's very controversial as well. DEI
Yeah, for sure.
is fortunately a bad word, but in certain cases, it just depends, just like
Mhm.
everything. It depends on like what the goals are, what the intentions are, and how you want to kind of maneuver. And ultimately, if your heart is in the right place and if you're looking to help patient populations and serve, and you have that experience and background and know how to do so, then you're the best candidate, no matter if you're white, brown, yellow, it doesn't matter at
Yeah,
this point. And so I
absolutely.
think I think that's a fair point. I think we don't want to say here that you have to look like a certain person in order to kind of deliver at a high level
Yeah.
to the patient populations that you think about. If we kind of look at obviously chest, there's so many intricacies around the certification and what it can deliver. So if you're going in, so maybe in a 5-minute kind of conversation, what are some of the high level things you kind of communicate to healthcare organizations? We work with a lot of individual medical practices, multi-specialty groups. Sometimes you work with higher organizations, but when you talk to maybe smaller groups, what are some key things that they can do now, like maybe like items that they can start it with in implementing kind of these practices, these chest practices inside their organizations?
Yeah. Well, the challenge is systems change is one of the hardest things to change. Systems are really hard to change. And even talking to leadership within the hospital, it's much more than them that they have to consider with that choice to make. And integrating CHED certified individuals in the continuum of care, it's clear, it's obvious. I mean, there's definitely billable service that can be reimbursed, but it's happening in some places, but it's not happening in a lot of places. I think it's like looking at the idea of it and the benefits, not just from the financial standpoint, which are financial benefits to it, but also the time. How can we give physicians back some of their time or time with patients? I believe I had just did a presentation about bias and empathy and building trust and rapport within health professionals and the community. And I believe the average time spent with patients are about 17 minutes. There's no way to build trust with someone within 17 minutes, especially if you don't want them always at the hospital for something that could have been treated at home or over the phone or handled through the online system, communication system. There's that issue right there. So how can we give more physicians their time back? And that's through integrating the health professionals like certified health education specialists. So I'm not sure how to answer that one. I don't know if we can cut that one out.
Well,
But
I think, you kind of hit the nail on the head. I mean, obviously, look at the financial incentive, that's always kind of baseline because it has to be a sustainable program, let's be honest. And, so if it makes sense financially, then to your point, investing in the time and effort, don't just look at the reimbursement, which is the top line revenue, but look at the cost time savings. Are you getting back more time and trust from your patient populations to deliver these type of educational services? And if that makes sense, if you kind of combine that into a nice little equation, you see it makes sense either start the program or bring on a specialist like yourself to help you implement the program once you kind of do your benefit analysis. And so I think that's extremely relevant as well. Just curious, are there certain codes and stuff that you guys kind of target when it comes to these educational services? How many is it? Is it quite a few? Are they growing all the time? Is this becoming more and more relevant for CMS, Centers for Medicare and Medicaid Services, to implement more of these kind of CPT codes that's billable and reimbursable?
yes, I know the codes are growing. I don't know any of them by heart, but I know there's more and more being added. They've been around for CHED certified individuals to integrate into the system. They've been around, but it's all about leadership willing to say yes to that opportunity. But now we're seeing healthcare costs are so high and hospitals are going to have to take a lot of that cost in because people can't pay for it. And so how do we level those things out by addressing some of that bottom line issue, which is health literacy, reducing ED visits and really educating people on when it's time to go to the ED, which is kind of hard, right? Because when I worked for poison control, we also were educating the community about utilizing these 911 versus poison control versus the suicide hotline versus going to the ED. Like, how do we best use the system for what it's for to prevent overcrowding
I love it. And I think that's important to kind of do all that and really focus on community awareness. That helps. And that's kind of like the top of funnel. If you think about marketing funnel, like making sure they're aware of what's out there for the patients themselves, but also talking directly to the organizations to kind of implement that infrastructure as the patients, are asking more for services to help educate them around these things. So I want to pivot a little bit. So obviously you're very knowledgeable about how to kind of educate patients and communicate it, but more importantly, not just one-on-one or in group settings, but on social media, right? And so we talk to a lot of doctors. As a matter of fact, that's how we get a lot of our podcast interviewees through the social media, right? Because we see your expertise that you put out there. Explain that, as if a doctor is looking to get into social media and kind of put their expertise out there, or just any healthcare professional, which is not normal, right? I think is kind of became more normal after the pandemic. But talk about that process for you to start doing more of that, and what have you seen the benefits from putting your expertise out there on social media?
Yes, I love that. The benefits of putting myself out there on social media as a health professional has been huge. People know that they can trust me as a credible source because there's a lot of information being put online by just anyone. I do a lot of LinkedIn Lives. I have a LinkedIn Live series that I do. It's important to address misinformation and misconceptions and the availability of different unique resources that can be available nationwide, not just in my state. So really letting people know what resources out there, how grants aren't just for business owners or nonprofits, how it can be for families who are in need of things. And again, addressing that misinformation. Sometimes what I'll do is I'll see a comment on social media that is actually misinformation, and that's unintentionally spreading information. I'll say health misinformation, right? And so I'll use that as a topic of discussion and address that. And I feel that when health professionals are going online, there's a lot of fear there because you don't want to say something that is HIPAA, that's wrong. I think as health professionals, a lot of them are, perfectionists, and that's not a negative thing, but we're like, we want to be right with what we say and put out there, because once it's out there, it's out there. And how don't we compromise our job or anything like that? But I think keeping it clear and basic and addressing the issue or educating people on what's possible or what could happen to them if they're riding a bike without a helmet. There's a lot of things that I follow on social media. People are really giving basic information that is going a long way for families. And like I said earlier, people don't think things will happen to them, which I hope things don't happen to me, but things happen to people who didn't expect it to happen to them. Things don't happen to people who expected it to happen to them, whether it's chronic disease or an injury. So being informed and making the proper decisions, I think as health professionals, getting online to be that trusted source is extremely beneficial. We're being outweighed by the noise, right? And so we need to be a part of that to address it.
When I talk to a lot of healthcare professionals on our podcast, we talk about that. I mean, there was a lot of healthcare professionals all of a sudden, right, during the pandemic, right? Giving spouting their wisdom and knowledge and what you should take and all this other stuff. And even now, the proliferation of just, so many different pills and things you can take for wellness and all that, it can almost boggle the mind, right? I mean, let's be honest, it's always kind of been there. Or commercials, I'm a little older, so infomercials used to come on late at night, things that kind of, boggle the mind. Having healthcare professionals who are generally passionate about but understand the science behind it. And I think it's important that more individuals like yourself go out there and communicate that to the populace. And so I agree, putting yourself out there and just starting, I think is key to that. And, we highly recommend that to every healthcare professional.
One thing I learned was never give direct advice. Like, you should take this if you're this, and this, unless it's like basic stuff you can make in your kitchen. You just really have to be careful with that, right? When you're giving like direct advice on medications and things like that, I don't recommend that at all, because everyone has different health issues. And as a health professional, you would know pretty much, hopefully, not to do that, because people can go off and try something and then it's impacting another issue or medication that they're on. And so, like I said, keeping it basic, but really highlighting some big issues is what health professionals can do more of. I need to see more of them online for myself to refer people to quality content and quality pages to follow versus, again, all this noise that is misinformation.
Oh yeah, we just had 2 cardiologists, and Dr. Jane Morgan was one of them. And, just listening to them, they're always doing great things on social media and communicating their expertise around healthy heart and how to kind of take care of yourself and maternal health. So I agree that there's actually stories of just that trust factor, right? So a lot of them are starting to kind of reach out and they trust you. That does become, to your point, a little gray area, but the goal there is to help people and give them ideas and what things to kind of ask your doctor and your professional as you kind of go through the process. So definitely, I see more and more healthcare professionals promote their expertise and just helping people, like you said, and giving guidance, but not, direct direction as we try to go
Yeah.
through
One
that.
more thing I'll add is that we have to remember that we are the experts. We have gone through a lot of education and experiences to speak at the level that we do. And sometimes we're using acronyms or words that we feel that other people should know, or we're not even really thinking about that. So again, we have to break it completely down using basic terms, right? 90% of adults are not health
Mm.
literacy. It's lacking among even the most educated adults. If we're going online wanting to be helpful to our community, we have to break that communication down. Especially it depends on who you're trying to reach. If you're trying to reach other doctors, then of course you can speak high level and some of them are still learning as well. But if we're trying to reach community with education and awareness and resources, we have to break it down.
Well, this has been a great session, very informative, and your background is insightful. What are you up to now? What's the next things that you have out there and promoting, not just health literacy, but just in general around healthcare that you want to kind of talk about?
Yes. Oh man, it's been a lot of good things keeping me busy. I'm working on several different projects, but right now that I'm promoting is our community impact intensive for health professionals. And they're going to learn about our 5-step community impact framework, where they're going to learn how to build trust with communities. It's leadership development and program development, pretty much. It's all about how we're building trust with community and our teams, how to track performance so that you can identify the gaps in your efforts, how to build capacity with new partners or existing partners, re-engaging them, because there's organizations who have hundreds of partners, but a lot of them are probably unengaged. So how do we reignite engagement? They'll learn how to market online and offline so we can reach our people and get good attendance at our events and online forums. And then impact communities. That's part of I just said the 5-step framework if you're following along. But the impact communities is the 5th step. And how can we quantify the cost of effective community engagement that benefits the organization and the community, right? How are we addressing any type of barriers to access, health equity, health literacy, social determinants of health, all the good stuff. So currently the Community Impact Intensive is available to any health professional who is developing programs, who are on coalitions or associations that want to build leadership and program development skills.
Where can one reach out to you on Instagram or social media, or where are you located?
Yes. You can find me on Instagram at Jenkins, Jenkins _public health. And then you can find me on LinkedIn as well, which I love and spend a lot of my time. Brittany Jenkins on LinkedIn. I have like a blue halo around my frame.
Awesome. Awesome. Well, thank you so much, Brittany, for your time and insight. We talked to a lot of practices around the country, medical doctors, and they're really looking for more advice. And so hopefully this impact can help them as they kind of navigate the new normal of healthcare. Thank you for your
Yeah.
time.
Thank you so much.